of our Health Services Committee, please. Can we start with the Office of the Aging? Dee, are you available?
Motion to approve the minutes, Peter?
Yes, please do that. Supervisor Beatty, seconded by Supervisor McGowan. All those in favor?
Aye.
Ms. Parks, are you in the room?
Yes.
Thank you very much. You have a request to amend the contracts with Glens Falls Hospital for the Medical Alert Program. Can you give us some
Correct.
perspective on that?
Yes. Basically, they're going to be selling it to another company, so we just need to amend our contract to include language with regards to that. The fees and everything will stay the same. It'll just be a new entity that we contract with.
Wonderful. Can I get a motion to approve that? Supervisor McGowan, second by Supervisor Beatty. All those in favor?
Aye.
Opposed? Any referrals, pending items, any discussion items, Dee?
No.
Very good. Then can I please get a motion to adjourn?
Nope, no, don't adjourn.
No.
We're public up.
Okay. Good. We'll, jump right into our Health Services Committee and our visiting nurses. Janelle, we want to award a bid and authorize agreement with the lowest responsive bidder to provide transportation services to eligible children in the early intervention and committee or preschool program in Warren County. Can you provide some rationale, please?
Right. We have to have the ability to provide a provision for transportation. That's a requirement of the early intervention and the Committee on Preschool Special Education Programs. A viable contract is needed to be in place, and the current vendor has requested contract amendments that are requiring us to go back out. The bid proposal is in process, or the RFP is in process, and the lowest responsive bidder and rates will be known tomorrow on October 20th. And that will be prior to your November 20th Board of Supervisors meeting. So we're hoping to be able to get that in place so that it can be acted on at the November meeting.
Wonderful. Can I get a motion to approve that? That's Supervisor McGowan.
I'll second it.
Seconded by Supervisor Frazier. All those in favor?
Aye.
Opposed? All in favor. Resolution number 2, the amending contract with North Country Home Services to reflect the agency's 2021 home health aid rate of $37.20, which is a 4.8% increase from the 2020 rate of $35.50 per hour, and to amend the contract to automatically renew and allow up to 5% negotiated rate or decrease increase with termination upon 30-day written notice by either party. Janelle.
So this agency provides paraprofessional services, including home health aid services for our home care patients, especially in the northern parts of the county. To date in 2020, we have not utilized this agency, but we do need to have this service provision in place should our home care patients in that area need service.
Can I get a motion to approve that across? Supervisor McGowan, seconded by Supervisor Schipper. Any discussion?
Yes, thank you.
Please.
4.8 and 5% are very hefty increases considering the times. Is this what we've had as increases in the past with this company?
Actually, last year it was 13%.
13.78% last year, which did come up. The unfortunate part is they're the only ones we can work with. And I'll just give you an idea for history of what we paid them. I did a little spreadsheet. We paid them a little over $1,500 in 2017, $2,300 in 2018, and last year $678. So usually up in the North Country, we have 1 or 2 at the most patients. And unfortunately with PPE and everything that's happened with COVID, we're seeing that they need an increase. They did come ask us initially for a little bit more, but we said that, the max we came up with years ago was the 5%. And they did bring it down to under 5%.
Thank you for the history.
Sure.
Supervisor McGowan.
Yes, thank you, Tom. I do remember that. It was kind of definitely a floor dropper there at 13%. We're like, what? Everybody would like that kind of a raise. But I know we reviewed it. We went over and we negotiated, and And like I said, for the amount that we pay every year, you know, I understand, you know, the cost, especially now with the pandemic and that. So
Right.
thank you very much for putting the boots to them and holding them down to our, under our 5% agreement.
We have a motion and second on the floor. All those in favor? Opposed? Dawn, a request to transfer the funds in 2020.
Correct. Attachment number 3. Basically, back in April, we got an additional $7,700 for our BT grant to work towards COVID. I've already billed for that. This is just putting things in the right bucket because it touched a salary line. I had to move some into salary and some out of in other places. So we billed $7,695.19 of the $7,700. I was only $4.81. I couldn't find, but anyway, this is just putting everything in the right buckets because in the general ledger, it's showing negative numbers and they just have to be moved. And as soon as it becomes a salary issue, I have to bring it to committee. So it's just to correct all that in the
Great.
general
Can I get a
ledger.
motion to move those funds, please?
I'll make that motion.
Supervisor Fraser, second by Supervisor McGowan. All those in favor?
Aye.
Opposed? Carries. Any further information, Dawn, or no?
Not on that, but I do have the next one, which is attachment number 4, which is our revenues and expenditures. Our financial statement as of October 9th is when I printed this. We're again staying pretty much the same. We haven't done anything in the process of closing our September right now. I've noted that year-to-date COVID expenses are $84,307.50, and $61,996 of that, or 73.5%, are just related to salary and fringe, which is most of our grants. There are other expenses. Down in the salary comparison, you see at the bottom of that page, you'll see that year-to-date, we are 59.28% of the budget, where last year at this time, we were 73.92. A big part of this, though, I do want to, again, mention is the COVID. We would be less in numbers, but we did because of all this. Our overtime that's related to COVID is $22,800, around $24. And then our COVID time related to per diem, mainly not so much part-time, is over $30,000. So between the two of them, they make up a very big part of it. Of course, we have not utilized clinics. We have not seen some patients. Referrals were down back in the spring, obviously, with everything going on. So that's why our numbers are down overall. But the COVID numbers are reflected in these, and I just wanted to bring that to your attention. Attachment number 5, which is the just comparison of last year to this year. Again, just to bring to your attention, well, the salaries are what we just spoke about. Contractual expenses, again, we're just getting our last numbers in, trying to get all the expenses in that are related to preschool and early intervention. Many visits, they are down because, again, with COVID, a lot of parents don't want the face. They are starting to see them in person now, but some are still doing Zoom, which is allowed. One thing I did want to bring to your attention is the revenues. We are still, I say it every month, but I just want to keep you updated. We still have not been able to bill the second preschool program expenses to the state yet. They say they will not allow us to bill until they know that they can pay us. So we're thinking that's going to be over 400. I think I said in the past over 400, close to $500,000. So we just can't reflect it until we can bill it. But that's something we'll be seeing in revenue, and that's why revenues are down. You will see up above our expenses are down by $888,000, and then our revenues are down by $1.1 million. And again, as I've always said, if the revenue's down, usually the expenses are down and they correlate. So that's where they are. One thing to also bring to your attention, like I said, is our MCH, Reach the Children. We're not really doing anything in that program right now. And our clinics, we haven't been, obviously, but now we're getting into flu time, and now we're just setting up, which you'll discuss, also some rabies clinics, just to get us through. So you'll see that go up a little bit. But one thing that I did want to note is that we did receive this month $13,000 from the state. That was for the data exchange incentive program, which was to put in place our clinical program to work and retrieve information, like I think it's called Higsley, if I'm right, Tammy, is that what it's called? And it's so that we can look into the chart and get information on a patient, and we can get into that. And that program was built last year, but we got the payment this year. So that just came in, that $13,000. So that was good to receive. And that's where we stand right now.
Thank you, Dawn. Any questions? Supervisor McGowan?
Yes, Tom, and this might be both of you. I've noticed in the past, what's becoming more familiar with, Zooming with your doctors, and you just mentioned Zooming with your nurses. I mean, how's this working out? Is this a savings?
Well, we're not Zooming with the nurses. These are the therapists with the children that they've been Zooming with.
I'm just thinking on if we can start, zooming in on some things. I'm just wondering how, but it seems to be working all right with the children.
I don't know if you want, yeah, some families will do it. Some families it's just not doable, with their children. These are special needs children, most of them.
Okay.
So if our service coordinator or therapist or somebody is Zooming with them, they can bill for that time and it's a visit and they can do it. If they don't, then obviously there's no visit, there's no expense. So, and no revenue. So that's where you see the revenues down, expenses a little down because they haven't seen as many, but I think it's starting to build up a little bit. We'll see how it goes for this fall, as we all know what's going on with schools and stuff. So some of these, they do see them in person. And all our adult therapists have been seeing, they've done no Zoom with the adult. A lot of these are different clientele when you talk about the elderly, and they wouldn't be able to Zoom probably. Obviously what they need is a nursing visit or a therapy visit. So they've been with PPE and everything they need to do to get in to see the patients.
All right, thank you.
Any questions for Tom from any committee members at all? Seeing none, Janelle?
Right, just continuing on our discussion items, we've got attachment number 6, which is our status of referrals, just reflecting our numbers for the month. We had a positive last month. We were all excited. This year we kind of dipped to -9, but if you actually look at the numbers, you're looking at about 10 patient difference. Also attached is our emergency preparedness report. We've been doing a lot of COVID and that's reflected on that report. In addition, we have the rabies program report. Just worth noting, we do have to, through our general public health and state aid, is offer a minimum of 4 rabies clinics a year. With social distancing and COVID response, we haven't been doing that. Just to be clear, we have had the provision should somebody call and need a rabies shot that we've been working with a contractor so that we could, satisfy that need if there was one. But we did actually this past weekend start our rabies clinics back up. We've got 4 scheduled for this year. Hoping to do some in the spring as well, but we at least are going to have the 4. Saturday's clinic was totally booked. We're doing appointment only, which is different. We're doing dogs in the car. The cat carriers are coming in. Town of Queensbury has agreed to host. They had a better setup for us to be able to do that so that we can maintain social distancing. So in your packets, have attached our rabies schedule. Should you want to help us advertise those. Meeting authorizations, we have 2 that are virtual. The numbers reflected on the actual authorizations actually decreased due to some discount pricing that we had, so that's always good news. And the last thing I have, I've got 2 discussion items. The first is an electronic medical record with our Certified Home Health Agency, or CHA. I do have specific details if you're interested, but I think for the purposes of the meeting, I've kind of come up with general discussion points. But should you want to go further, Amanda can advise us as to what we need to do from that perspective. So today I would just like to start the discussion on us switching to another electronic medical record. Since our implementation of our current system, which came in 2018, we've experienced issues with that application. We've worked with the county attorney's office, which has helped facilitate some response with the vendor, but there are issues that just can't be resolved. The system has failed in implementation with our agency. Our administrative staff are incredibly frustrated. Our fiscal staff is frustrated. Our clinicians are frustrated with lost notes. They've actually quit complaining because they know that They complain to the administrative staff complains to the vendor. There's a myriad of reasons as to why it can't be fixed. And, you know, at the end of the day, it's just extra time and effort for them to complain. So they've quit doing that. Our surveyors, when they come, they don't like our product and they'll give their frustration. And then we have an outsourcing agency to help us with our coding, and that certainly, our system has created a lot of issues with that as well. Some of the benefits of us changing the system would be to dramatically improve staff morale and administrative staff morale. Like I said, they've kind of stopped complaining, but they would love to know that they've been listened to. A better application will better serve our agency's need. And the hidden thing is a significant cost savings for our agency. The monthly fees that we pay, some of the newer products can actually save in those monthly fees. We've looked at 7 different applications so that we know that there are applications out there that could better serve our agency. The startup costs are much less than the current system that we have in place. And the monthly costs are also estimated to be less. We do have some challenges though. We're in a 5-year contract with the current vendor with 3 years to go. So we're working with the county attorney's office for guidance. We've also been working with purchasing as well to set up an RFP or request for proposal to maybe allow some other vendors to give us what they can do to help our needs. So with that said, I just kind of wanted to give you a little bit of a forecast of where we would like to go. And I'm hoping that we'll be able to, select another product at some point. The good news is we do have deferred revenue from our district monies that would more than cover the cost of what we're looking to do. So it wouldn't be extra money. And I don't know, Tammy, is there anything you want to add to what I might have missed? It's true. So.
I do have a question, Janelle. Are there many vendors out there that provide this kind of service?
Well, there's many. We've looked at 7 in addition to the vendor that we currently have.
Okay. So it appears as if your rationale seems to indicate that, in the foreseeable future, a change in vendors probably makes sense. That would seem to be my conclusion based on what you said.
It would be very fiscally responsible if nothing else.
Okay, very good. So, McGowan.
That's Supervisor
John
there. Janelle, this is really concerning, and I want to thank you for bringing this up. Actually, I personally feel that you ought to move forward. I wouldn't worry about the legalities right now. I mean, I don't want to say that too loosely. We do have some legalities in the contract, but in my opinion, I'm sorry, we have a contract with a company that it's not working for us. Our employees are stressed and they're missing stuff. Our attorney's not here right now, but Mr. Chairman, I would like to say, please, let's move forward in getting this on, and we'll hammer out the difference right now. But right now, that's very discerning, especially for what your department does. This is kind of brings up kind of like the hospital billing thing. You know what I mean? This is not good. So I would like to thank you for bringing this up. And like I said, we shouldn't have waited so long, but anything for your department to make sure that we keep everybody happy and smiling and our records correct, I would
thank you for your
give
comments.
you my support.
Thank you for your comments, Supervisor McGill. Supervisor Beatty, I'm sorry, I didn't see your hand.
Yeah, thanks, Mr. Chairman. So let me get this straight. We entered into a 5-year contract 2 years ago, and now costs of competing vendors has gone down dramatically. Is that correct, Janelle?
Well, we've actually been using this particular vendor since 2008. They changed their product because they were no longer supporting an older product, so we went with their new product. But we started it in 2018, and if you remember, many of our committee meetings, we had increased overtime costs because our nurses were losing their notes and having to put in their notes 3 and 4 and 5 times. Every time you put in your note, the quality goes down, 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 because you give your A+ effort the first time, your A+ or A- effort the second time. As far as the cost, I don't know what the cost of the other vendors were at that time because I wasn't involved in that RFP process. But I do know that the costs are significantly lower now for us if we were to use a different vendor. And not only for the startup, which I kind of have an estimate on the low end, it costs $3,500. But most of them are between $3,500 and $8,000 to start up. And then there's a monthly fee right now, and Tammy can correct me if I'm wrong because she knows she's more of a number person than I am, but I want to say we're playing close to $7,500 a month, and we can go down to $3,000 a month.
Okay, so that's very detailed. I appreciate that. So we have a very low startup cost. Our monthly rate would be maybe a savings of, let's say, $3,500 a month compared to our current vendor. Is that correct so far?
That's correct.
Okay, so as long as we legally can get out of this current vendor who's causing nightmares to our staff, is obviously seems to be overcharging us for a service that we can get much more cheaply. I am 1,000% behind any initiative that our county attorney's office can go forward with in seeing if there's an out clause in this 5-year contract. Sometimes there is, sometimes there isn't. Contracts are often very complicated. Sometimes there's a buyout in a contract. But if we can save approximately $42,000 a year just in via $3,500 a month and so forth, it makes a sense that if there is a buyout in that current contract, that we definitely look at that. And the morale, if we are able to go to a new vendor, obviously morale-wise, that's super, but financially, that's even a bigger win for the county. So thanks for bringing that up, Janelle, and bringing that information forward. And hopefully you'll be in contact with Mary, or Mary's already maybe involved her office in seeking. She's not. She just shook her head no. Okay. So would you contact Mary's office and see if she can pull that contract and see if there's any potential outs for the county or buyouts or whatever, please?
We'd be happy to. And I just would like to take this opportunity to let our nurses know that we are hearing them. We are listening to them. I thank you, Supervisors McGowan and Beatty, for kind of acknowledging that we do need to do something. And I'm really hoping that through the legal contract scenario that we can work with Mary and kind of figure out something. To Mary's credit, this was a discussion that we had on Friday, so I think an email was drafted or crafted, but she probably hasn't had the opportunity to look at that yet. But anyway, I thank everybody for letting us look at this, including purchasing and helping us come up with options.
Supervisor Bruno, did you have something?
Yes, thank you, Mr. Chairman. Janelle, you do a great job, and we're all very concerned about the morale of your staff, et cetera. Just one question, maybe a stupid one, but these other agencies that provide similar service, you have looked at their track record. In other words, you know that they're better, and that's probably a pretty low bar by the sounds of things, but better than what you have now. In other words, you have some sort of resume that says that they can perform and do the job and do it correctly and better.
Absolutely. We actually came up with a grid, and we've already done research on the 7 that, we through our trade know were the higher quality items. And I think our staff are thinking that there's a handful of those that certainly would be a much better option than what we have now. And, they've worked with other home care agencies as well. In addition to our fiscal people have been working with them. And we have the plan to continue, to research those vendors. We just wanted to start the conversation through the committee to let you know what we were working on at this point. We're not finalized.
Very good. Very good. I appreciate that. And I'm 100% behind this with Supervisor Beatty and McGowan. I think it's an excellent idea. And again, if it improves the function and morale of your staff, I'm all for that. And I think everyone else is. Thank you, Mr. Chairman.
Thank you, Supervisor Bruno. Any further discussion by any committee members? Brian, do you any observation on this, or we just forge forward in terms of evaluating our options?
Yeah, no, we talked about this actually late Friday night, and absolutely, we've got to get a better solution if we can make that work.
Thank you. Any further discussion by, go Janelle, yes.
Are we on to COVID or are we?
Yes, please. Go right ahead. Yeah.
Okay, so just kind of a quick update on the 16th. I prepared a report for the 14th, and thank you all for the nice honor that you bestowed upon our agency. But for today's COVID report, the mandatory quarantines are total to date are 971. We have active 42. I'm happy to see that number starting to climb back down. We've completed 929 of the mandatory quarantines. The precautionary quarantines are still mandatory. They just are people that are able to work or people that are watched. I mean, we still contact them on a daily basis, but that total is 557. Our active number is down to 19. Our completed is 538. Our travel quarantines, we're up to 1,608. Our active travelers are 63. Our completed are 1,545. As far as cases go, we were very happy over the weekend and so far today that we're doing well with zeros. We like the big round zeros. But our lab confirmed cases to date are 406, which includes 380 that are lab confirmed and 26 that are presumptive. Of those lab confirmed cases, the 380, 117 have been in skilled nursing facilities. I'm very happy that that number is remaining the same. The assisted living's 13. In the community, I actually just recently changed that number to 227 so that I could create a new category for our schools so that you could kind of track that as well. We've had 23 cases to date in schools. Just a quick note of schools, since September 8th, we've had the 23 cases and we've had 213 contacts. If you take the 23 cases, that's around 9.26 contacts per case in our 4 school districts. However, you can separate that down a little farther. 10 of our 23 cases, we didn't have to do any school-related quarantines for because the schools are doing a phenomenal job with their safety plans. And of the other 13 cases that had contacts, it wasn't that the schools weren't following their safety plans, it was the duration of time in most of these cases where we had to quarantine a whole classroom. So for those 13 of the 23 cases, that was about a 16.38 case average, as far as contacts to case. Our current cases, 2, I really want to see that go down to a 0. So my fingers are crossed this week that we're not going to see a lot of new COVID activity. Hospitalized, I'm very thankful that that's 0. Recovered, 343. The deaths, again, a horrible statistic to have to report because each of those represents a loved one, a loved family member, a loss, a sacrifice during this awful pandemic. But of the 35, 9 were in the hospital, 22 were in skilled nursing facilities, 2 were in assisted living, and 2 were home. As far as testing, and this is as of 10/14, we've had 18,902 Warren County tests. Those are residents within Warren County that have been tested. Now, some of those might be duplicate tests because they might have to be tested once a week if they work in a nursing home. Some of those might represent, other exposures or this, that, or whatever. But of those 18,902 tests, so call it close to 1,900 tests, or 19,000 tests, sorry. Those have all been Warren County residents that have received those tests. Jumping to our testing clinic site, we've done over 3,000 tests to date. As of the 7th, where we have our statistics, it was 3,154. Of those, 158 were positive, or 5.01 were positive. That number is shared with 5 counties: Warren, Washington, Saratoga, Essex, and Hamilton County. I'll say the bulk of that is probably Warren, Washington, and northern Saratoga County. So with that in mind, on Friday, just so that you're aware of the latest and greatest, we submitted an application through the State Health Department to do rapid testing. Now, we're in the itty-bitty infancy stages of that. Number one, it has to be approved. Number two, the counties that they're approving are most likely going to be in the hot zone state or parts of the state. So if I'm excluded because of that, I'm very happy that we're not a hot zone, or we're not red, yellow, or orange. So I guess if I have to forgo rapid testing to not be in that status, I'm happy for that. This is going to be totally dependent on what the state gives us, if the state approves us, and what we have to work with when all that happens. But we did submit the application for New York State review, and it's both for the general public and for schools. Our county feels very strongly that we work with our schools. So what we've done for the public, we're looking to do free testing for the public. We're looking to help the people that are symptomatic, the people that have been exposed, maybe target areas. So we have a lot of the vulnerable people, people without insurance, people without providers. We're looking to provide for them. With the schools, we're helping, for those that don't know, if you're in the red or the orange zone, schools have to go remote. If you're in the yellow zone, they have to test 20% of their population weekly. Well, most of our schools aren't set up to do that testing when you look at the sheer numbers of what has to be done. So I figure since the county has that ability, we can piggyback the schools onto the county. We can change our CLIA waiver, because we do have a lab waiver, to be able to do a rapid test, to include that rapid test, and to include all of our school districts to that waiver as a satellite site. And then we would work in training and writing up the policies and procedures for the clinics for the schools. And we would make sure that we train school staff to be able to do that and work in conjunction with us to be able to do that, I think is the best way to go. So right now, we're not testing schools. We're certainly trying to gear up and prepare to do that so that if we get approved, we're ready, willing, and able to help our school districts, which I think we'll be very happy for. This doesn't mean the school district has to test. If they're in the yellow zone and they don't want to test, they just simply go remote and they don't have to do the testing. But if they want to stay open and they have to do their 20%, we want to be there to help them do that so they can stay open. The schools will have some responsibilities with this, and this is more to come. It's just, I figured that, a lot of the schools are going to be talking about this in the Board of Eds, and this was an opportunity to update you all as our committee as to, letting you know where we stand with the testing and the rapids. We did apply, we're waiting to hear, and we are wanting to work actively with our schools and the public to offer this resource. The schools, we're looking at hosting the site. It'll be socially distanced. We'll look at, that they provide an RN to kind of oversee that testing at their place, that they train some staff that we will obviously be helping to do. And the other big piece of that is entering the lab results into the state's Eclair system. So we'll have to get them up and running and to do that. So with that, I think I am done. So if anybody has questions, I'm happy to entertain those.
I do have a question, Janelle. In terms of the turnaround time currently with our current system testing,
schedule, I don't know what I'm gonna do.
in terms of comparing that to the turnaround time to a rapid testing system, what would be the differential?
The rapid tests are usually ready within about 15 minutes. We will have to also look at that. Do we send people home and call them with the results, or do we keep them here for the 15 minutes? I mean, looking at socially distancing and what that's going to look like, we're still looking at the specifics of that. But typically the test that we're doing right now, which is the PCR test, that's taking usually between 2 and 5 days, but right now we've been seeing 2 to 3 days.
It is the rapid testing system, is that a saliva test, or is that
Well, the two tests that are being offered by the state, and I applied for both. I'm thinking if we had one, we could be sharing the other equipment or vice versa. And then just kind of increasing our chances of getting approved. And I wanted to be credentialed for both. They're right now just a nasal swab. But how that looks, we haven't really gotten into the nitty gritty of that. We're just in the infancy stages of the approval process.
Again, thank you for your proactive approach to, a difficult issue. So any questions, Supervisor McGowan?
Well, I was just thinking, we have that 15-minute waiting period. I'm thinking, and there's, I want to make sure we spend all our COVID grants. I'm thinking maybe we can, do what we need to do in our old jail there. We can set everybody in a cell there for the 15 minutes, and then let them move on once they're clear. What do you think?
Probably not going to work, but I appreciate the suggestion.
All right. I'm trying to think out of the box.
There you go.
Chairman.
Any comments from any committee members? Seeing none, no hands up. Janelle?
I just want to say one more thing. I appreciate everybody's patience on the flu shot schedule, but we will be putting that out soon. Our goals were to vaccinate our staff, vaccinate the seniors in the high rises that can't get out to other places. And then we're going to be looking to set up our schedule very, very, very soon.
Thank you very much. Do appreciate that. Again, seeing no further comments, can I get a motion to adjourn? Supervisor McGowan, seconded by Supervisor Scheffler. All those in favor? Thank you very much.